But first to the United States, where health officials are warning the country that it's at a pivotal point in the pandemic. Vaccinations are slowing while a number of new infections are surging. Yesterday, there were more than 43,000 new COVID cases. That's an increase of almost 250% since the beginning of the month. Tens of millions of Americans remain unvaccinated and at risk of being infected. Can they be convinced to get the shot? Dr. Anthony Fauci is the chief medical advisor to U.S. President Joe Biden. He is also the director of the U.S. National Institute of Allergy and Infectious Diseases. Dr. Fauci, so good of you to join us. Thanks so much.
Thank you, Kathleen. It's good to be with you.
So cases and hospitalization numbers are going up in nearly all 50 states. Can you help me understand why that's happening?
Well, yes. I mean, it seems to be pretty clear. We now have in the United States the Delta variant, which started off as a few percentage and then went up to 20 and then 50. And right now, 83% of the isolates are the Delta variant. And in some regions of the country, particularly some of the southern states where the level of vaccination is very low and the level of transmission of virus is very high, we're seeing a significant surge in cases. This virus has an extraordinary capability of efficiently spreading from person to person. So when you have a considerable number of people that are not vaccinated, even though we've done quite well in this country with vaccinating people, in the sense of particularly the elderly, 85% or so of people over 65 are vaccinated. That's a very good thing. But when you look at the country as a whole, particularly among younger people, we still have a substantial proportion of the population that's not vaccinated. And that's something we absolutely need to correct. Because when you're dealing with a variant like the Delta variant that is so efficient in spreading from person to person, you are going to see the kind of surge in cases that you mentioned. And for those who are vulnerable, like elderly and some people with underlying conditions, the chances of their getting hospitalized increases when you're dealing with a variant such as this.
So what is the secret to persuading people who aren't getting vaccinated to get vaccinated, particularly in certain geographic areas, which you note, where they're having more trouble than other places?
Well, what we are doing here in the United States is trying to engage trusted messengers who people in the community would be able to relate to much more than they can relate to a government official like myself. So, for example, if you would get people who are clergy, family physicians, healthcare providers, or even admired people from the community like sports figures or entertainment figures, we're putting a lot of effort in engaging with those individuals to get them to go out and try and convince that recalcitrant group of people who are not getting vaccinated. We have a particularly difficult situation in this country, in our country, the United States, in that a lot of this is along what you'd call political ideological lines, where you see states that are fundamentally conservative Republican states that, for reasons that are not explainable, like they don't say they think it's unsafe or they just don't want to get vaccinated. We've got to get beyond that, because if we don't, we're going to have that gap of people who are not vaccinated, which means we'll never be able to completely crush this particular outbreak. And that's what we have to do. We really have to nail it down. We can't have a substantial proportion of people who are vulnerable, who are unvaccinated, and who are getting infected, and then wind up never ever being able to just put it to rest and put it behind us.
And you know, we've observed that people, well, for example, some of the anchors at Fox News have been more sort of robust, let's say, in their championing vaccines. We've seen that from the governor of Florida, I think, in a more robust way. And I suppose even someone like Donald Trump could go some way in persuading people, especially as you talk about those who identify as Republicans being perhaps the toughest to convince and reach?
Well, what you mentioned is something that I think is a real bright light, possibly to guide us through this, is that we are seeing politicians like Steve Scalise, who's a very powerful Republican member of Congress, who is out there right now talking about why it's important to get vaccinated. So people like that, and even as you mentioned, certain anchors in Fox News are out there now saying you should get vaccinated. That's a very different situation than what we were seeing a month or so ago, where there was a lot of pushback on the part of leaders either in Congress or in the media, in the conservative media. We're seeing that some of them are starting to come around, which is really a very, very good thing, because we've got to realize and act on it that the common enemy is the virus. And the virus doesn't have any idea who's a Republican, a Democrat, or an independent. The virus is an equal opportunity attacker, just goes after anybody. So the idea that there's any division along party lines just doesn't make any sense when you're trying to control and ultimately crush an outbreak with a virus as powerful as this.
Now, just to add another layer to this, Dr. Fauci, we're also seeing more breakthrough infections among those who have been vaccinated. So how concerned are you about that? How concerned should all of us be about that?
Well, I think people should not get overly concerned. I mean, obviously, no one likes to see breakthrough infections. A breakthrough infection, by definition, is an infection that occurs in someone that's fully vaccinated and is 14 or more days out from the last dose of a full vaccination regimen. Since no vaccine is 100% protective, and the clinical trials that demonstrated the efficacy of these vaccines were really using as the endpoint clinically recognizable disease, which means that it doesn't necessarily protect at 90% against any infection. So you're going to see breakthrough infections. That's the sobering news. The good news about that is that when you look at the breakthrough infections, very often they are either asymptomatic or mildly symptomatic. Very few of them, none of them, but very few of them actually go on to severe disease leading to hospitalization and death. So although you don't like to see these so-called breakthrough infections, generally people don't get into serious trouble when they're vaccinated and do have a breakthrough infection.
We are still at the stage where we're trying to get people double dosed, never mind triple dosed, i.e. booster shots, and you haven't ruled out that that might be necessary at some point, but that it's too soon. So what would be the criteria in your mind? When would we have some idea whether that's going to be necessary over the next, say, year or so?
Well, what you do is you follow cohorts of people who have been vaccinated, and you know what the general breakthrough rate is of a cohort. If you start to see that breakthrough rate increases significantly, that could be a good indication that the immunity is waning somewhat. So we have a number of cohorts that our CDC is following. We have people who are in the original phase 3 trials who are being followed very carefully. And we don't feel right now that we need to booster people, namely give them that additional third dose superimposed upon a double dose regimen like mRNA or a single dose regimen like J&J. But that doesn't mean that we're overconfident about that. We're following these groups very carefully, and it is conceivable that sometime in the future, we may need to booster people, and it may be a differential among the people. By differential, I mean, it may be that some people more than others will require a booster. For example, the elderly or people who have underlying conditions, such as those who are transplant patients who are receiving medications that suppress their immunity, or some people with inflammatory or autoimmune diseases who are on immunosuppressive drugs, or any of a number of people with cancer who are on chemotherapy. Those are the people who might require an additional shot before the general population does.
Dr. Fauci, I'm really curious to get your take on the decisions that are being taken on our shared border, because as you know, Canada has decided it's going to allow fully vaccinated Americans to come into this country. The U.S. has not reciprocated, so and we're talking about the land border here. So fully vaccinated Canadians cannot enter through a land border into the U.S. Now until at least August 21st. And I suspect there's some politics involved in that, but I'm trying to understand, is there any science involved in that? Because I can't, and I think most Canadians don't really understand how a fully vaccinated Canadian coming into the U.S. poses any threat.
Well, you make a very good point, Kathleen. I mean, as a public health official, sometimes it's difficult to figure out why policies haven't changed. I can tell you that the border situation and letting Canadians in who are fully vaccinated is an area of very active discussion right now in the U.S. government. I can't comment on that, Kathleen, because that's not my lane to comment on that. But I can tell you that it is something that is being seriously discussed.
But you would concede that there's no scientific or medical reason to not allow fully vaccinated Canadians into the country.
You know, Kathleen, you'll have to excuse me because I don't want to comment on that, because what happens, it gets taken out of context in a soundbite, and the next thing you know, it's being used in a way that I don't want it to be used. I only say that I look forward to the time when we could have open back and forth between Canadians and the United States citizens.
Okay, that's fair enough, and I know that you've had plenty of experience with that happening to you, so I certainly appreciate your caution. If I can just ask you one more question, because I'm curious about this as well, will the types of vaccines be a determinant, not just for Canadians, but for also other countries, because there are countries that have used vaccines approved by the WHO that the U.S. has not approved. In Canada, we've used AstraZeneca. Do you see that being a complicating factor in all this?
I think most of the vaccines have an efficacy profile that's good enough that I think it will ultimately be accepted as a vaccine, that if you do have proof of that, you can come in. There are a couple of vaccines, and I'm not going to point them out publicly, where the efficacy signal is really quite low.
Okay. Dr. Fauci, really good of you to take the time. I know your schedule is a very busy one, so thank you so much for being generous with your time. I appreciate it.
My pleasure. Good to be with you.
You too.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.